Okay, let's start now. Welcome everybody to the FADWU International Women's Day Zoom talk. Today our topic is how to treat COVID with our guest speaker from Health in Action, and also Know Your Rights with the speaker from FADWU, Jack, our secretary. We can ask the Ansel from Health in Action to start the first section.
而家請醫護行者嘅講者為大家嚟第一部分就係呢個新型冠狀病毒嘅最新資訊同一啲自救嘅方法。
Okay, I think someone is unmuted, but good morning, everyone. My name is Ansel, and I'm from Health in Action. I hope everyone's doing okay. And today, we're here. We're an organization that aims to promote health and also reduce health inequities among the local communities. And today, we are giving this presentation to help you understand more about COVID-19, both in terms of the disease and how to help yourself if you are sick, and also I know that the government rules right now are very confusing, so we will want to try to clarify that. So let's begin. So due to the short time because of the technical difficulties, I will be speaking a bit faster and also summarizing more. But if you have any questions, feel free to ask more in the Q&A section later. So as we all know, since the start of this year in January, there has been a lot of cases, and it's been growing every week until now, where we have over 400,000. And of course, there's a lot of different difficulties among the community right now. So just for you to be aware of, the hospitals are all very full, pharmacies are all very full. As you might have seen, many of the markets and grocery stores are very busy and maybe empty, some of them. And there's a lot of people having to go through government mandatory testing and other issues.
Sorry, please stop for a while. The Cantonese channel is not working. Watermelon, can you check your device? Oh, 聽到。Okay, you can start.
Okay, so continuing on, some other things that we must be aware of. I'm sure many of you would have heard of it already, but if you haven't, then please be aware that there's also news about compulsory testing, which means everyone in Hong Kong must do the test, and also a potential lockdown in mid to late March. The details about this haven't been made clear by the government yet, but this is just to let you know to look out for these. So now that we know about the current situation, maybe we can talk more about how come Hong Kong has been going through this. So some things you need to know are that the new variants, so the reason why Hong Kong has this outbreak right now is there's a new type of COVID called Omicron that came to Hong Kong late last year, and the outbreak right now is with Omicron. So in particular, you need to be aware of that it is much easier to spread than the previous type of COVID. And the current vaccines might not be as good, which means if you're already vaccinated, you can't be as safe as you were before, but it is still very important because it still protects you by about 69% with 3 BioNTech doses. And another thing is that because of the new type of variant, while it is easier to spread, the chance of you having a big problem from it, like having to go to hospital or having serious like respiratory issues is much lower than before. So today in the talk, I'll be talking about first of all the COVID infection and the symptoms, and then how to test for COVID-19. And then we'll use this information and put it together for you to now then understand how you can prepare for it, and also if you happen to be infected with it, what you will have to do. So to begin with, I'll talk more about the COVID-19 infection and give a basic overview about the infection. So if you haven't heard of it, this is how the infection will usually go. So at the start, you'll have day one where you're exposed, which means you're eating with someone, maybe they were sick, but they didn't show a symptom yet, and you ate with them, or your family member, you met them, then that would be exposure, and you will not have any symptoms, so you'll not be coughing, and you'll also not be infectious, which means you'll not pass it to anyone yet. But soon after, during what we call the incubation period, which means the period when you actually have the virus inside you, you're infected, and you can also give it to other people. But during this early time, you will not be coughing, you'll not be having any runny nose or any symptom. And then next, you will have the symptomatic period, which is when you have coughing and also you can pass it to people. And finally, you have the recovery, which is day 9. Usually, but it can be different between different people. So it can be 9, 10, 11, even 14 days. And during this time is when you will be recovered, which means that you have no symptoms, and you also are not infectious, which means you will not pass it to other people. And this is when you test negative on the test, which I'll talk more about later. So some key things that you should know from this is, number one, that everyone's timeline is different. So even though here it says 9 days, that's only the usual. You might be shorter, you might be longer. And that's why you must be careful that you don't just don't think that just after 9 days you're recovered. And then another thing you need to know is that there's the incubation period, which is the time when even if you test positive, if you're not coughing, you're not fever, you can be infected. It's just that you haven't had symptoms yet. And that means also that you have a risk of giving to other people, which means you must isolate and stay safe as much as possible. Moving on, I think we all know already, or if you don't know, then now you'll know. But these are the main symptoms you will get from COVID, and especially with the new variants, over 80% of the cases are no symptoms or with very little symptoms. So these are the basic symptoms like fever, headache, muscle or whole body pain, sore throat. And there's 2 types of coughs, either dry cough, which means you don't have anything coming out, no phlegm or sputum, and wet cough, which is you have phlegm coming out. And then there's runny nose, stomach ache, diarrhea, and vomiting. These are maybe the less common ones. Most people will have fever, pain, sore throat, and cough, and runny nose. So the key thing to note from this is that most of the cases you will have very little symptoms, which means that actually given the situation now, you can actually stay at home and you do not need medical help unless something more serious happens. Now, I think the big question most people have is how you can treat the symptoms after you get infected. And there's many different medicines. So the most important thing that you have to know is that most of the cases, because they have very little symptoms or there's no symptoms at all, you'll recover completely by yourself. You don't need to take any medicine. Technically, you don't need to take any medicine, and you don't need to go to hospital. The medicine is actually not to cure the disease. So if you eat any of these, you'll not recover better or faster, but it will help you to relieve the symptoms, which means if you're coughing so badly that it's painful, or your fever is very high and it's dangerous, then you will help to lower it like this. So the medicine is still important, but just know that if you eat these, the aim is not to help you recover faster or better. So some examples of the medicines you can take, it will be for each symptom. So for fever, you want to take paracetamol. These are the drug names, but in the interest of time, you can look at it later for reference. But you can see on the left here, these are the brands that the drugs will be given in. So some common ones you can take note of are Panadol, which is for fever, sore throat, and body pain. Cotulin, which is for runny nose. Mucinex, which is for coughing with sputum, which means it will help you to cough out better. The sputum, and also decough, which is also to help you cough. And these medicines you can usually buy from Watson's or Manning's or other pharmacies by yourself. But remember that when you buy these, try as much as possible to ask a pharmacist at the pharmacy for if you are okay to take it. Because some of these medicines, for example, if you have liver problem or if you're young children, you cannot take them. or it will be dangerous. So you want to try to ask a pharmacist if possible. Another thing is that recently there have been many delivery services for drugs or medications to send to people who aren't able to leave the home. And a lot of these services don't have pharmacists, which means that you don't know if maybe there's a reason why you shouldn't be taking a drug or medicine. You don't know because the pharmacist didn't tell you. So please be aware that it might be a bit dangerous to just trust these types of services. Now, we know that most of the cases will have very mild symptoms and you can just stay at home to recover by yourself. But when you're staying at home, you want to make sure to check your own condition, monitor yourself, and see if you have any worsening or serious symptoms. So some of these are the serious symptoms that I put here. And if you have any of these serious symptoms, you want to call one of these numbers as depending on how serious it is. So if you're only a bit worried, so you can call the hospital authority hotline, which is here, 1-836-115. Or if you're having something serious like bleeding or chest pain or seizure, then you just call ambulance straight away. So these are some examples. If you have fever over 38.5 for 2 days, even after you take medicine, then that is quite serious. Or if you have, one of the common ones is that if you have shortness of breath, which means when you're talking, maybe you talk one half of the sentence and then suddenly you feel like you're out of breath and you need to breathe. Or if you just feel like when you take the breath, you're not breathing enough. Some other examples are chest or abdominal pain, or so if you have pain in the chest or abdomen, or if you have feeling more tired than normal, so badly that you maybe faint or you like suddenly sleeping when you're not planning to sleep. Or you have seizures, difficulty in eating, drinking, speaking, or moving, or difficulty in urinating. And then one important thing is that if you're pregnant, you want to watch out also that if your fetus, which means the baby inside, stop kicking or has less kicking than normal, then that's also a serious problem. So now that we know the information about COVID, of course, the thing we are confused about, I think many people, is how to test for it. So in Hong Kong, there are 3 main types of tests. Rapid antigen test, PCR test, and stool antigen test. Today, I'll only focus on the rapid antigen test and the PCR test because the stool antigen test is only for infant, like baby and young children, or those that cannot give the rapid antigen test or PCR test specimens. So I know it's a bit confusing, so don't worry too much. Just know the main 2 are rapid antigen test or RAT and PCR test. So what is the test used for? The test is used for 2 things. Number 1, of course, is to see if you have COVID or not. So if you're coughing or if you met someone who has COVID and you want to check if you have COVID, then the test will help you to check if you're positive. And number 2, the important thing is to know when you recovered. When you're recovered, if you stop coughing, it doesn't mean that you're completely recovered because people can be different. Maybe you just recovered coughing, but you still have the virus inside you. So the other thing, the test is when you're negative on the test, according to government rules, that means you're recovered. If you are not negative yet, you cannot assume you're recovered, even if you have stopped your symptoms. So for the PCR test, it's there's 2 different types. The deep throat saliva specimen, which is, as you can see the second picture on the right, this is a bottle you will get from the government, and then you give your own saliva inside the bottle, and then you can submit it to different places to collect and test. The other type is the community testing center. So the one on the bottom, that is where you have to go to the place and test it with the doctors there. And then, of course, we all have heard of, I hope, the rapid antigen test, which is the one at the top. And this one is, you can do it at your home and you can read the results by yourself. So let me explain a bit more between the main 3 that we can consider when you're worried about being infected or you're showing symptoms already. So the 3, number 1 is rapid antigen test. This one you'll be doing by yourself at home. It's a nasal swab, which means your nose. So you only need to put the bud inside the nose and then rub it around and then use that as a sample. I'll explain a bit more later, but this one you can do completely by yourself, and the test will be done. The test result will be available straight away. And you must purchase this by yourself from stores or pharmacies. I know maybe for different people, if you are a migrant domestic worker, maybe your employer is the one who might purchase for you. So maybe it's not as relevant, but in case you do need to purchase by yourself, the price is around 20 to 200 Hong Kong dollars. It depends right now on which store you go to or how many are available. But just know that this is you have to buy yourself. And then for the deep throat saliva PCR, it is you give your sputum, which means you throw out your phlegm into the bottle and then you test it. So this one, you can get the bottle from different distribution centers, including clinics, hospitals, and also MTR stations and post offices. So you can then deliver these to the collection centers. But because if you're already showing symptoms, you should not be leaving your home because you should be isolating. That's why to deliver these to the different places, you need to ask a friend, a GoGo van or a pickup to send it for you. GoGo van, you can book online via the website. It will cost 100 Hong Kong dollars, but the test itself is free. And the test result will be given to you by SMS from your phone. And the third type is the community testing PCR, which is the one where you have to go to the place and then do the test. And you can book this by the website, or you can also walk in. But if you walk in, you might have to wait longer. And it will cost 240 Hong Kong dollars unless you have compulsory testing notice, which it will be free. And also the test result will be given by SMS. So which one should you choose if you are sick? So right now, the government is actually trying to make more people do the rapid antigen test because for the PCR, there's just too many people and they can't handle it, and it'll take too long for you to get the results. So we would recommend that you do the rapid antigen test, which means that you would have to buy it or have your employer buy it, and then you can do the test at home by yourself. The good thing is that it's very easy to do and you can get the results straight away, but it is a bit less accurate than the other two. And the deep throat saliva test is the other one that you can consider if you're symptomatic. And the reason why the rapid antigen and deep throat saliva test is the two that we recommend are because these two are the ones that you can do at home without leaving your home. Although for deep throat saliva, you must arrange delivery. Because in the community testing center, you cannot go there if you're already coughing or have fever. They will tell you to go away, which means it's not as useful, especially if you're already sick or you have coughing like that. You can't go there. So it's only relevant if you have compulsory testing notice or you're a close contact. So mainly we focus on the first two. So how do you read the rapid antigen test when you do it by yourself? So just to explain how you do it, it's quite simple, but you can read the instructions or ask more in the Q&A section later. But you'll have the swab, which means the little cotton bud, and then you'll put it in your nose, not too deep, but so it's quite easy, but only up to the back of your nose, and then move it around a bit, and then put it into the bottle with some liquid. And then after that, you'll drip the liquid onto this white color thing. And how to read whether it's positive or negative, you see there's two lines. It will also tell you the instructions on the packaging. But if you see that there's two lines, even if the second line is very light and not very clear, it means you're positive. If there's only one line, which means only the C line, then you're negative. But if the one line is on the T, or there's no lines at all, it means that something is wrong with the test, like it is not functioning correctly, and so you need to test again. So just remember that there should always be a C line, and then whether or not there's a T line, if there's a T line next to the T, then you're positive. If not, then you're negative. Even if it's very, very faint, like if you can see on the picture here. Another thing, maybe it's not as relevant, but just be aware that there's different brands for the rapid antigen test. And only some of them are valid according to the government because they have been tested and approved. So if your employer gives you or you buy yourself these tests, you just be aware that they should be these ones given in the picture or according to these lists if you want to check further. Because not all of them are reliable. Some can be like you can test it and it's positive, but you don't know whether you're actually positive because it's not working correctly. Now, maybe something more relevant for you is I think a lot of us are now being worried because the COVID situation is so bad. So it's quite likely that we have a higher chance of being infected. So please try to prepare in advance, because the main thing is that while these things are not that hard to get, hopefully they're not that hard to get. The bad thing is that you can't leave your home after, or you shouldn't leave your home after you have symptoms or you're coughing. So you need to get these in advance, and not only when you are sick, then try to get them. So some of them that you can be aware of include food, water, which are of course everyone would need. But also one thing that maybe people might forget is personal hygiene products like toothpaste, soap, disinfectant, especially disinfectant or bleach, which you would use to disinfect your home if you're living with other people, living with your employer, or living at, maybe if you're working, living out while working, then you have to disinfect with the other people living with you. And then other things are healthcare supplies, including the medications, like the ones I mentioned earlier, like Panadol. And if you have chronic disease, like if you're going to the public clinic to get heart medication every week, I'm not sure if everyone has this, but maybe a few of you might have something like this, then you need to try to prepare these earlier. Maybe you can try to call, if you're running out and you only have 1 week left, you can call the clinic and ask if you can go earlier to get more, so that if you have to quarantine, you have the medications enough to last you a week or two. And then other things you can try to prepare is maybe rapid antigen test or deep throat saliva bottles. So you can buy them or collect them and keep them at home in advance. And another thing, which maybe is more important for if you're a migrant domestic worker and you're living with your employer and you have a particular thing that you're working to do, such as you're taking care of a pet, or you're taking care of a baby or a young child, or if your employer is like a grandma who you need to support, then some things you can get are pet food, baby diapers, and milk formula, or employers' specific needs. Like if they're elderly, they might need medicine and so on. And by yourself, you can also prepare your own knowledge about some things, including your own medical history, your drug allergy, or any of these key hotlines like ambulance hotline or the one I mentioned earlier for the hospital, 1-833-019. Now, I think the most important part for most of you is now after you have tested positive, what do you do and what is the next steps you can take? So I broke it down into 3 possible situations. So if you are symptomatic but you haven't tested positive yet, or if you're tested positive by RAT or you tested positive by PCR, here is exactly what you should do next. So if you're coughing or having runny nose or fever, but you haven't done the test yet, you should try to do rapid antigen test or deep throat saliva test by yourself. Which means if you are prepared, like in my last slide where I said to prepare in advance, then you or your employer giving you the test, you can do these at home. Or if you really don't have any, you can ask a friend or a family member, if you have any family in Hong Kong, to get the test and deliver to your door. But you should try not to meet them when you collect the thing. So they can leave it outside your door and then you just collect it. So the main 2 ones would be rapid antigen test and deep throat saliva, PCR. And remember, as I said earlier, that you cannot go to the community center. Number 1, it is not allowed, and number 2, even if you can, you should try not to go even if you can, because you have a chance of passing it to other people. So for the benefit of Hong Kong and also everyone to try to go through this pandemic faster and have less people infected, then you shouldn't try not to go outside, because you shouldn't be going outside even if you have even for other things. But remember that if there's an emergency, like you have a serious issue, like cannot breathe or bleeding, then just call the ambulance or try to book a designated taxi to a clinic, which is here on this website. These are special taxis that can send you to the special COVID-19 clinics. And this is to avoid you going in public transport. Now, number two, if you have tested positive by RAT, which is probably the most likely scenario going forward, what you should do is number one, take a photo of the result, and maybe we recommend you write your date or your Hong Kong ID on the test so that you can show it's you and when you did it. And then another thing is that before you would have to do another deep throat saliva test to confirm, but now know that you don't have to do this anymore because the government is trying to tell more people to do RAT. So what you should do instead is just tell the government by calling this number 1-833-019, and this is for the Stay Home Safe scheme. And right now the government is trying to set up an online platform to submit the positive results. But it's not ready yet. So please keep a watch out in case in the future it's ready. Then you would just need to submit your test result, we assume by picture, onto this web platform to tell the government. And then in the last case, if you tested positive by PCR, which means you did the deep throat saliva or you went to the center and then they gave the SMS result to you by text, then you can tell the government by putting all your information and the SMS testing information on this website. And it's quite easy to do. You can do it by yourself. Just put your name, your birthday, and your Hong Kong ID and everything there. Now, I think many of us are also confused where you'll be going after. So there's three likely situations. Number one, you'll be sent to the hospital or quarantine facility, which means like if you've heard of Penny's Bay or other facility. These are for mostly the serious cases. So if you are having very serious symptoms, or if you're older or younger, or if you have chronic illness like heart disease, if you're pregnant, or if your household conditions. So maybe you're living in a subdivided flat, or if you're working out, then they might be more likely to send you to these areas.
How was
And
that? How was the first breakout session?
And another thing to note is that if you have symptoms and you're either pregnant over 37 weeks, or you're a child, or you have a child under 2 years, then you should go to the hospital straight away because it is a more serious patient. Other option is that you're sent to the community isolation facilities. So these are new facilities which are located around Hong Kong, and it's just for you to stay in so that a nurse can monitor you while you're there. And this is also by the decision of the government. So if depends on the case and how many spaces there are, like before. And then lastly, the most common is that right now, because there's too many hospitals and quarantine facilities being full, and there's too many patients who are being tested positive, the most likely is that you'll be asked to stay at home while you wait to go to other places. And that means you'll be waiting at home for about 14 days or 6 to 7 days, which I'll talk about later. But you'll be only staying at home, and that's because you can recover by yourself in most cases. If you're, as I said before, 80% of the people will be asymptomatic or have less symptoms, which means you'll not have any serious issue and you can recover by yourself after about 9 days or 8 to 10 days. So, but if you do need help, which means if you don't have Panadol by yourself, or if you feel worried, you can try to look at the designated GOPC, which means the public clinic. If you want to know more about this, you can ask more of the question and answers section later. And then to visit these clinics, you should be booking the designated taxi, which means the special taxi to send you to the clinic. And you want to check your condition, and if you have serious issues, you can call the ambulance. So the most likely situation is that you'll be staying at home, which means that you should not leave the place of quarantine. So if it's your home or if you're living out, you should not leave the area. unless you have an emergency or the government tells you to leave and go somewhere else. And even if you do need something, like you don't have enough medicine or you don't have enough food and you need someone to give you the food, you can call your friend or a delivery service. But for this, you should avoid face-to-face contact, which means you should ask the person to leave the food or medicine outside the door, and then you can go out and pick it up without meeting them. And you should, of course, not have anyone like your friends or family, or if you're living with your employer, you should try not to have face-to-face contact with your employer. And so basically to avoid face-to-face contact. And then, of course, to self-care with medications and the other tips. So besides medicine, some things you can do are you can drink some warm water with honey. That's for your sore throat. You can also try not to sleep flat or lie down too much, because this will make the coughing worse, because you cannot cough out as easily. And then you should try to keep drinking water and avoid any alcohol or smoking. And then, of course, as I said before, always try to monitor yourself, because only you yourself can know if you're getting worse or not. And then you need to know when to go to the hospital and see the doctor. So if you're by yourself, I'm not sure about everyone's living situations if you're a migrant domestic worker, but you should try as much as possible to stay in a separate room or an area of the room. So if you have your own room, you should try to stay in your own room and not meet anyone else who is not infected. Or if you're living in you have to share a space, then try to keep your own area as much as possible. You close the door of the room, of course, but you can open the windows to allow airflow to clear the room better. And you should leave the room if you need to go to the bathroom or the kitchen, or if you need to throw away rubbish. And then, of course, do not have face-to-face contact with others. So if you're living out, then maybe don't have face-to-face contact with the other residents. Or if you're living with your employer, then not with your employer. And you should not share personal items. So no toothbrush, no towels, no clothes, and no other utensils. And then you should also disinfect all the surfaces and everything you usually use quite often, like your phone or water bottle, or other things that you would touch a lot. And perform hand hygiene, close the toilet lid before flushing, and wear your mask. So these are some of the examples of what you can use to disinfect. So if these two are alcohol, and you want to wait 30 seconds, but maybe it's a bit confusing. So the most easy for you to understand is just bleach or Dettol. So if you're using bleach, you should dilute 1 bleach with 49 ml of Dettol, or 2 to 98, and so on. So for this, you can mix bleach with water, and you need to expose the surface for 30 seconds, and then wipe it again with water. And please make sure to, if you're using this, to ensure that you have good airflow to make sure that bleach is not dangerous to you. And then you can also use Dettol at a 1 ml Dettol to 40 ml of water. And this is recommended by HKU. So the last question we might have is, now if you've, let's say, I know a lot of people right now from our experience are having to stay at home and home quarantine for by themselves, because they try to call the government. They've already told the government, but the government has not arranged anything. And that will be the most likely case if you are not having major symptoms. So if you're only coughing a bit, fever a bit, and if you have no symptoms at all, you'll be likely at home by yourself, or with your employer in your own room, or as much as possible. And they might not be able to arrange anything for you or give you any test results even after 14 days. So here's what you need to do to know when you're allowed to leave. So you count the number of days, where day 1 is the day after the specimen collection, which means if you did the rapid antigen test on, let's say, the 2nd of March, then the 3rd of March is the first day. If you did the PCR, it's the same. But if you did the PCR and you don't remember when you did it, so let's say you did it like last week, but you don't remember which day, and you lost the record, then you count the day you received the SMS as day 1. So if you had 2 doses of vaccines, then what you would do is you do a test on day number 6 and 7. So that means you count after day 1 until day 6. On day 6, you do another test for the rapid antigen or PCR. And day 7, you do the same. If both are negative, then you can leave, which means you're considered recovered and the government would allow you to leave your home and do all your daily activities as needed. But if you're still positive, then you have to wait until day 14 to test again. And then if you're negative, you may leave. And if you're still positive after day 14, in all cases, then you will just keep testing every day. And when you are negative, you can leave. And then if you haven't had 2 doses of vaccines, so if you had 1 dose or 0 doses, then on day 7, you do the RAT or PCR, and then on day 14, you do it again. The difference is that if you're not at home, if you're, let's say, in a community isolation facility or a quarantine facility, then after day 7, if you're negative, you can go home and test again later, and you can home quarantine. But if you're still positive, you must stay in whichever place you were in before. And then on day 14, you will test again, and that if you're negative, you can leave. So as you can see, the difference between if you're vaccinated with at least 2 doses is that you can leave earlier at day 6 or 7 if you are negative. But if you did not have 2 doses, then you cannot leave even if you are negative on day 7. You should still be home quarantining until day 14. And lastly, just something we can touch upon briefly is the Stay Home Safe scheme, which is for if you receive a notice from the government that you're a close contact, which means you met someone who had COVID, or if you're a household of the close contact, which means, let's say, if your employer went to meet their friend who got COVID, which means your employer is a close contact, that would make you, if you live with your employer, a household of the close contact. So if you're a close contact, you'll have 14 days where you'll stay at home and wear an electronic wristband, which you can see on the right. And it'll be linked to the mobile phone app. And then you must stay at home for 14 days if you're a close contact, and 4 days if you are a household of the close contact. So for each different, there's of these types of quarantine, there's different number of tests you have to do. So for 14-day, you do on 1, 4, 7, 10, and then you go to the community testing center on day 12. And if you have any issues, or if you tested positive while you're at home, you would call the stay at home hotline, 1-833-019. And since we're approaching the end, I hope it was helpful that you understood everything, but I know that it might be a bit fast because of the short amount of time. So if you have any questions, feel free to ask more. But some final notes is number 1, that because of the situation that's changing and very serious, even the government is not that clear on what you should be doing or what the future plan is like. So please try to watch out for updates. But I do know that maybe if you speak different languages, it might be difficult to access the news. So number 1, you can maybe have your local community or NGOs that would post the news on their social media. And number 2, the Center for Health Protection in Hong Kong. You can find that by looking coronavirus HK, and they will have a website with different languages of translations for the official coronavirus notices, which include Hindi, Urdu, Thai, Nepali, Bahasa Indonesia, Tagalog, Bengali, Vietnamese. So basically, most of the languages will be there, at least for the basic information. And then this is important because soon there might be compulsory testing, quarantine, or lockdown measures by the government. So you will try to look out for these. And number 2 is please be careful about misinformation. If you're told by your friend, or if you're told by Facebook, if it's not a proper group like a NGO or the employment agency or the government or the hospital itself, then it might not be wrong, but it might also, you might want to be careful whether it's correct or not, especially if they tell you something serious like, oh, don't take this medicine or take this medicine. Then just double check with someone like a doctor or pharmacist or an NGO about whether it's correct. Thank you, everyone. I hope it's useful, especially I know it's very confusing right now. And we're happy to take any questions about any of the parts that you would like to ask more.
Sorry, our meeting was delayed for 30 minutes, so I think the meeting will prolong for 30 minutes, so we will have the QA until 11:30. And anyone who has a question, you can unmute yourself on the bottom of your phone. On the bottom left, there is a microphone icon. You can click and ask questions. I think there's already a question in the chat box. The hospital now are full. We have Thai workers who has children under 2 years. The mother goes with the children to the hospital for several days, but not being able to see the doctor. So is this still, should we still go to doctors at this time?
So I'm assuming here that the child is sick with coronavirus. I'm not sure if they tested positive or not. But so I think you mean that the mother goes with the child, but they weren't able to meet a doctor. So what you could do is, I'm not sure exactly where in the hospital you went, and I'm not sure exactly the child's condition. So but I'm assuming here that you tested positive and the child tested positive, and also that you went to the, I think you did not go to the A&E. So if you really cannot get into the other areas of the hospital, like the, so what you would have to go to is the A&E, and they would triage you depending on how serious it is, which means they will prioritize you if the child is very seriously sick, or if they are worried that the child would be sick, then they would let you go in first, and there's different waiting time, as Emily said in the chat.
Anyone with questions, now you can unmute yourself and ask questions.
Okay, let me ask. So we have quite a number of workers, domestic workers, got COVID. Some have more serious symptoms of or illness. Some are lighter. How can we expect when we can leave home, because it's very depressed to have home quarantine. So when I feel I'm because some people only a few days already feel like recovered, but some people still have sore throats, some coughing. So how can we know when we can leave home? If I get recovered only after 3 days, I can already leave home, or how?
So the definition of when you can leave home is, sorry, let me go back. It's, as I said, it would be here, where the definition of whether you can leave home is not whether you are still coughing or not. It's the number of days since you tested positive, and then if you tested negative on the test after the number of days. Because even if you recovered, because these symptoms are not very clear and everyone is different. So let's say your coughing might be better, but then it's like you only feel that better, and maybe the throat is still inflamed. It's just that it feels a bit better, or it's recovering but not fully recovered. So the main worry is that even though you feel better, it's good for you, but then you might still be infectious, which means you might pass it to other people. So that's why you must still stay at home until the number of days. Even if you feel better at day 3, because you do not have a doctor to assess you, and you might have the virus still on you, or you might have virus inside you, which means you can pass it to other people. So you would still wait until you tested negative, which means the virus is low enough that you will not pass it to people.
So meaning after 4 days, I'm fully recovered with my self-test, still negative. I still have to wait until the 6th and 7th day with 2 days negative and until I can leave.
Yes.
Correct.
Yeah.
Okay.
And
So
it's
no,
also
no matter what, we have to stay at home at least minimum a week, 7 days.
It's also because the infection can have different timeline depending on when you're infected or not. So it's just to be safe, because if everyone just went out after they felt okay, that there will be, although most people might actually not be infectious anymore at 4 days or something because of a different time. Maybe they tested positive later on in their infection. But we must assume that everyone is at the start of their infection. Otherwise, some people would go out and still be infectious and pass to people.
I have a question to ask.
Sorry, Dan, will you speak in Thai or Cantonese? Okay, Sai Qua, please
Okay.
translate from Cantonese to English.
點樣辦？我哋有
等等，等等，等等，你咧熄咗個 interpretation channel， 去翻 off 咗先，去講粵，因為 jam 咗啊個聲。你熄咗嗰個Japanese channel， 跟住再講，得唔得 ？OK。
好。因為咧係我哋嘅會員係清潔工同埋地盤。
Working in a construction site for cleaning work.
感染咗啦。
He is infected.
所以咧係而家咧係隔離到一樣醫生講咧14日，佢 test 咗係一個
14 days.
但係咧清潔公司或者地盤公司而家咧嗌佢攞醫生紙，
But the employer requests them to have a medical certification.
去醫院都好難去醫院，所以咧有冇點樣法咧係有
go out and difficult to go to the hospital to have the certification.
傳染俾人哋㗎嘛。
Because if he goes out, it will be infectious. So how to do it?
The government chose a few to become
sorry, Ansel. Can you repeat, because when you were speaking earlier, I can't hear you in the English channel.
Yeah, I can hear you in the English channel.
Can you speak again? Yeah, can you repeat?
Hello?
Can you repeat?
Hello? Hello? Hello?
Okay, so for English speaker, please, I don't know what happened. Please turn off the language because we can only hear answer speech, not on the English channel. Okay, please go on.
Okay, okay, let me, hello, can you hear me now? Okay. Okay, so I was saying that if from what I understand, you were asking if you have a worker who is sick, but they need a sick leave note from the doctor, and you said that they cannot go out to normal clinic because they would pass it to other people. That's correct. They should not go out to the normal clinic. Instead, they should be going to the designated COVID-19 clinic. So it's a special GOPC for the government chose a few already existing ones to become the special COVID ones. For the full list, I think you can check our resources later. But you can call these places to book an appointment if you're sick, and then to go there, you can use the special service. You can see at the bottom here. You can call this number or go to this website and book the special taxi for COVID-19 infected, and they will send you to the clinic directly. And then you can go there and see the doctor to get the sick leave. If you're in quarantine, like in the community isolation facility or hospital or quarantine facility, they will give you the sick leave note when you leave.
There's some question in the chat box. Sheila asked, meaning even I am negative in test, but still have sore throat, meaning still not safe to go out. But what about if my employer asks me to go to the market? Maybe union leaders can also answer these questions. It's not a purely medical question. Dan, can you answer it?
Will there be any local authority help to explain to people or explain to the employer that if the worker is infected with COVID-19, she has to stay at home and has to have sick leave?
As far as I'm aware, there's the Social Welfare Department, Hong Kong, that's where they made the change in the law, and also they made the publication that workers should not be made to go out. But I don't know exactly if there is a hotline for this. I believe other NGOs can help more with this, given that it's a social issue. But in terms of Sheila's question about if I'm negative in a test and you have sore throat. So for this, technically by the government's guidelines, you are allowed to go out assuming that you did it correctly on a correct day. So on day 6 or 7 or day 14. But of course, you might just want to be careful by yourself, or if the sore throat itself is like painful and it's hard for you to go out, then you would maybe want to discuss with your employer, as Emily said.
Yeah, so under the standard contract, domestic workers can have sick leave. So do request and tell your employer you are ill and you have to have medical consultation. And ask for the sick leave certificate.
There's another question from Rati. what are the impacts on the body that need to be watched out for after recovering from COVID-19?
So for these long-term impacts, the research is not as clear, but some of them that have been found they include like long-term respiratory issue, which means like the hard to breathe thing. You might have long-lasting difficulty in breathing. There's also other issues like loss of taste and loss of smell. And also, I think they recently discovered in Hong Kong male virility issues after COVID-19. But we would usually not emphasize the focus on this as much because it's maybe not as relevant to like your day-to-day life, like if like whether you can go out quarantine or not. If you have long-term effects, it doesn't matter in the short term. But if you're worried more about long-term effects, you can access other resources. But as I said before, some of them that been found include loss of taste, loss of smell, and respiratory issues. But usually, if you have more serious issues like the respiratory issues, then you would already be in the hospital, and the doctor can tell you exactly what kind of long-term issues it looks like you might have.
Another question from the chat. If I'm in the exposure stage, is it possible that I can infect others too? Thank you.
So for the exposure stage, it is not possible technically because in that case, you're not infectious yet. But please be aware that, I'm moving to the correct slide. But please be aware that exposure stage is defined as the time when you're not infectious. So by definition, it means you cannot infect other people, but it does not mean it's day one exactly. So it might be day one, you've already in incubation period. So if you tested positive on day one, but it's because of how unclear it is, like when you were infected usually, because it's not like you only went out at one time and you were infected on that day. Maybe you went out on 3 days, but you don't know which day is the one or who you met that gave you the virus. So it is correct that if you're in exposure period, you cannot be infectious, but maybe a better way to think about it for yourself is if you are tested negative, you're not infectious. Because technically, by definition, if on exposure day, you should be testing negative. But maybe if you are not clear about when you're infected, so you don't know when it is actually exposure period, what you should be thinking of is if I'm tested positive, then I'm infectious. But it is possible, I think, if you're not infected, you can also pass the virus by contact if it is in your nose, but you're not infected yet. You can still, like, if you actually touch your face and touch somewhere, then it is possible, but it's maybe not as relevant because usually you will not know when you're in exposure phase because you only know after you show symptoms or if you tested positive. So by the time you know, it's already incubation period. So it's already here when you know, or later.
Another question from Sheila. I don't know I am positive and I met friends or relatives, but after a day I find out I'm positive. Is it advisable to let all people I met to take tests too?
Yes, that's very correct. If you tested positive, usually what you should do is maybe think back the last 2 or 3 or even 4 days, depending on what you wish. But usually I think the minimum is 2 days. Where you should tell these people that you tested positive and that they should maybe be tested too, because they would be considered close contacts if you met them, especially if you met them without your mask on or you met them in a personal space, like you met them in their home or something.
Another question.
Mạnh thầy không có sai. Không có xứng mạnh thầy. Cái vậy là thầy chắc là than hổ to, không chi bên cò còn lè. 我哋用鹽水啷口，同埋飲檸檬水，會唔會話殺得菌或者幫助得啲乜嘢？唔該晒。
Yes. If you try to drink, if you're feeling symptoms like cough or sore throat, you can drink a bit of warm water with lemon or honey, and these can help you feel a bit better. But it will, once again, as I said, it will not help you recover faster. It will just help you feel maybe not as painful or make the cough not as bad.
Okay, another question from Ravana. How about if all of the household is test positive? It's okay to stay together in one house, and what to do?
Yes, if all of the household tested positive, then it's okay to stay in the same house. However, if you're like 2 people tested positive and 1 negative, then you should still be isolating. But it's still good to, even if you tested positive, everyone tested positive, you should still be doing the hygiene measures, like I mentioned before. These ones, like don't share your personal items, disinfect surfaces, hand hygiene. This is just, for example, to make your household just, it doesn't take much effort, and you should be doing it even if you're not infected. But if everyone's infected, you should be trying to still do these isolation measures. Just that maybe it's okay to have some face-to-face contact.
We have still last 2 questions in the chat box. My boss first quarantined at home after 2 days. I got not feeling well, sore throat, body pain, cough, felt cold, but in 1 day only happened to me. I drank 1 Panadol, following days only coughing. I have until now, but not yet I'm doing any test.
Okay, so I'm not clear exactly what your question is, but if you have not done any tests and it seems like your boss had quarantine, which means maybe they were a close contact, or maybe they weren't. I'm not sure exactly what you mean or what the situation is. But if you are feeling unwell with sore throat, body pain, coughing, these are, as I said, the common symptoms of COVID-19. And given that there's a high number of cases right now, you should try to test if you have COVID-19, and then you should be isolating. So this is the case where your test should be either the rapid antigen test or the deep throat saliva, so the basal one. You cannot go to the community center because they will not allow you to do the test. So what you should be doing is staying at home. If you need to discuss with your employer what you should be doing or whether they have any tests for you, or you can ask a friend to buy the test and deliver to your door. You should try to do those to get yourself tested. And for these different medicines, Panadol will help your body pain and sore throat and your fever. And for the sore throat, you can also take some other medicines if you want, which you can refer to our slide about the medicines, like including lysozyme. And if you have coughing, you can take some of the medicines also, like Cotolin. No, not Cotolin is for runny nose. So you can take some of the medicines like Mucinex. Mucinex, yeah. If you have a wet cough.
Okay, another question. How to avoid getting infected if employers going out anytime they want and come back home without taking the RAT immediately and isolating me at home with their kids?
So to avoid getting infected, you can do the just normal disinfection and isolation measures. So maybe you want to wear a mask at home. I'm not sure exactly. If you want to discuss with your employer about the infection risk, but um, usually there isn't much else you can do. Like I'm assuming because of your situation that you don't have much ability to discuss and negotiate with your employer. So you can try to talk with them as much as possible, explain your worries. But in terms of the actual medical situation, you can only try to disinfect, perform hand hygiene. Don't share any of the employer's things like their plates. And if you touch anything, you can wash your hands. And then you can wear the mask at home if you want to. And I think you can also focus on preparing for COVID. So like those things I mentioned earlier, where you can get the different food or medicines ready in case you get infected. And as another thing that Emily notified me is you can also try to get vaccinated in advance, but it might take some time.
Okay.
我想加一加，唔該，我哋家務工，他真係揾唔到其他幫手，可以求助我哋工會或者我哋 FADWU 或者我哋會員個團體都得㗎，打電話求助我哋先。一樣我電話614001600
find us to help our trade unions and FADWU. For help.
Okay, there's two questions in the chat. I will answer this like last two questions quickly. The first is, what if everybody at home has symptoms and they are doing the RAT test every day and test negative, and I don't have any symptom? Do I need to take the RAT too? The test makes me scared and nervous.
It seems like they don't have COVID, although there's a very small chance that it's a false negative, but it's very, very low that it's 99% correct. So we assume here that maybe they had different infection, maybe like the flu or something. I'm not certain because I haven't seen their symptoms or I'm not a doctor either. But I'm assuming here that if they tested every day negative and it's a reliable test and they did it correctly, then they are negative. And if you don't have any symptoms, you don't need to take the RAT. But if you want to just be comforted from the test, you can just do the RAT test. It's not that difficult. I'm not sure if you've seen it. So I don't think it's very scary because all you need to do is put the swab inside your nose, very, very shallow. So it's not that difficult. And if you want to just do it by yourself for reference, you can just do it. But in terms of whether you need to, you don't need to, because you're not a close contact, because they're not confirmed.
The last question is, I saw in news why some RAT tests can become positive even you put or drop it with Coca-Cola or orange juice. What does it mean?
So I am not sure exactly which news source you got this from, but I haven't seen this on the TV. So I'm assuming here that it might be some kind of different social media sources. I would suggest that you don't trust these sources because it is unlikely that even like maybe I shouldn't explain too much, but they would test for the antigen, which means only the COVID only the COVID virus would have, or the different variants of COVID would have the antigen. So antigen is like a little tag, so like a little like a thing that the vaccine the virus has. So only the virus can make it become red. But if even if something else was to make it become red, it is unlikely that it is Coca-Cola or any kind of drink because there is no test for Coca-Cola. So I would expect that this is likely to be some kind of misleading news. Maybe there's some agenda, like they are against, they are thinking that COVID is fake or some kind of issue like this. So I would suggest that you don't trust this, and you follow the instructions on the package, which means just do it according to normal.
Okay, thank you very much. And so I think we can take a 3-minute break, and we come back at 11:40 to talk about your workers' rights in the COVID. And there's still questions popping up in the chat box. I think people from the Health in Action can answer them in the chat box too.
So I think.
Sorry, Annan, can you repeat the question so that the translator can translate?
Okay, there's a new question like, good morning, all of us in-house. It's preliminary positive. I asked my boss to register it, but he said it's okay. I'm afraid if I didn't report, what if the government fine me $10K? What would I do? Maybe answer this quickly.
Yeah, so from what we know, you should maybe try to report yourself as positive. I'm not sure if you tested positive or not, so that's what you should be doing. But in terms of the other side, so the employer relations or the welfare, social affairs issue, maybe I think other NGOs can help more with this. But you can try to maybe report your own issue, your own infection if you're positive. And at the very least, you should try to keep on lookout for your own condition. Like if you're positive, you check, as I said before, you isolate, you do the disinfection, you practice hygiene, and then you can take the medicines and watch out your own condition. And if you have serious issue, then like if you have difficulty breathing or other of the serious issues, then you can seek ambulance help.
Okay, I think we can have a short break and we come back at maybe in 5 minutes, 11:45, and we discuss the next issue. And thank you everyone from the Health in Action.
You're welcome, Maran. I hope, I know it's a very difficult situation right now, so I hope everyone is doing okay and we don't face that many issues. And if we all try to do our best to manage ourselves responsibly, then the pandemic or the outbreak can be over soon.
Yeah, thank you very much.
Yeah.
I very appreciate all the work you have done. Thank you.